Hi, my name is Helena.
Gomez, and I'm going to be doing the family assessment.
Hello, I'm Kelly Shabeta.
Hello, my name is Svetlana Prager.
Hi, I'm Rameza.
Hi, my name is Dario Ghostin, and today my group will be presenting the Hiran 15-month acute otitis media case study.
Case study summary. Hiran is a 15-month-old toddler that was brought into the Acute Pediatric Hospital by his parents. His sister and grandparents also accompanied him. They immigrated from Pakistan 18 months ago, and the mother understands some English, while her ability to answer questions is challenging. The mom informs the nurse that Hiran has had a fever and runny nose for about a week, diarrhea that started a few days ago, and a slight cough for 2 days. Both diarrhea and runny nose have improved, except Hiran has become more irritable and fussier in the last 2 days. During the physical assessment, Hiran is irritated and crying. Abnormal findings include a heart rate of 143 beats per minute, temperature that is 38.5 degrees Celsius, and his right tympanic membrane is bulging, gray, and has no light reflex. Hiran was diagnosed with acute otitis media. The physician orders amoxicillin 60 milligrams per kilogram twice a day for 10 days to treat the infection, and Tylenol 15 milligrams per kilogram as needed every 4 hours for fever and pain.
All right, so we're going to assess this family. Family-centered care in pediatric recognizes the family as a central unit of care. By understanding the Calgary family assessment model, we can provide comprehensive framework for understanding families and their dynamics. The model consists of 3 major categories: structural assessment, developmental assessment, and functional assessment. Let's begin with the structural assessment. Hiran, a 15-month-old boy. His immediate family includes his parents, a 3-year-old sister, and his paternal grandparents. It's important to note that they immigrated from Pakistan 18 months ago, which adds a unique dimension to their family dynamics. In the developmental stage of the assessment, we observe the family's adaptation to their new country. Adjusting to different culture, language, and environment can present various challenges for the family. Understanding how the family copes and integrates into their new surroundings is crucial in assessing their overall well-being. Finally, let's dive into the functional assessment. Hiran's mother takes on the primary caregiver role, nurturing and caring for him. During the physical assessment, we observe Hiran crying while his grandmother holds him closely and securely. However, it's notable that Hiran's father and grandfather appear anxious and less involved. Standing back, in the context of the grandfather's assistance to attending to the 3-year-old sister's questions becomes a noteworthy aspect of their family function. By empowering the Calgary family assessment model, we gain a deeper understanding of Hiran's family dynamics. Through structural, developmental, and functional assessments, we uncover the complexities of their immigration experience, their adaptation to their new country, and the roles and interactions within the family unit.
Our priority diagnosis for this patient is risk for spread of infection related to untreated acute otitis media, as evidenced by poor health management caused by a language barrier and a lack of comprehension of medication administration. Our secondary diagnosis for this patient is acute pain related to ear infection, as evidenced by the child's behavior indicators of fussiness and crying.
Acute otitis media is bacterial infection of the middle ear, secondary to the upper respiratory infection, which occurs during the winter season. 3 main bacteria responsible for onset of these infections are Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis. Buildup of fluid and mucus inside of the ear causing obstructions and create negative pressure inside of the ear. This in turn leads into decreased ventilation and increased discharge from the inflamed mucosa. All this creates a favorable condition for the colonization of bacteria and virus. Kids 6 to 24 months are mainly affected. Boys are more than girls. Usual risk factors are excessive use of pacifiers, exposure to secondhand smoke, winter season, frequent upper respiratory infections. The clinical manifestation of otitis are atalgia, fever, noise inside of the ear, behavioral changes like irritation, restlessness, lack of appetite, and vomiting. If the infection is not taken under control timely, the serious complications may occur, such as bacterial meningitis, brain abscess, hearing loss, facial paralysis, and even seizures. Treatment for acute otitis media is usually started with non-pharmacological approach using observational therapy. Kids with no severe symptoms, unilateral infection only, moderate atalgia no longer than 48 hours, and temperature no greater than 39 can benefit from this therapy. If there is no improvement within 48 hours, antibiotic therapy is introduced, and starting with amoxicillin as a first choice of the antibiotic for the duration of 10 days. If it's not effective, Cefsil can be introduced to continue the therapy. For children who has allergy to penicillin, clarithromycin or cefuroxime can be used as alternative method. Surgical approach focus on the reduction of the acute symptoms like pain or managing recurrent infection. For example, laryngotomy, it's a resection of the eardrum. Focus on the reduction of the acute ear pain, drain of the fluid from the infected ear, and collecting the fluid for the culture. The tympanostomy tube insertion allow to drain the fluid and ventilate the ear. So this procedure is mostly for those who already develop complications such as facial paralysis or brain abscess to manage the recurrent infection. Adenodectomy procedure is a removal of adenoids. Focus on those who has recurrent acute otitis infections with postnasal obstruction or chronic sinuses.
The priority goal related to Hiran is after 10 days of antibiotic therapy, he will be infection-free. He will also not show any signs or symptoms of complication related to acute otitis media. His family will also have demonstrated an improved understanding and adherence to the medication regimen by correctly giving him the medication and making sure that they are done in a healthy manner. Additionally, they will have made sure that he attends all his follow-up appointments with his healthcare providers, such as the doctors and nurses involved in his care.
Nursing interventions. The first one is use the teach-back method to ensure that Hiran's parents and grandparents understand the importance of adhering to Hiran's antibiotic treatment plan. The rationale is that families can improve their knowledge and effectively manage the patient's care plan with appropriate education and training. The second one is teach precautions to use to decrease the chance of spreading the infection. The rationale is it is important for Hiran to improve and maintain a good immune system function. Approaches to avoid spreading the infection at home will include good hand hygiene and managing carefully and disinfecting the client's environments. The third one would be explain to Hiran's parents as well as grandparents his pain management and fever plan. This will include pharmacological as well as non-pharmacological interventions, the assessment and reassessing process, and potential side effects. The rationale is that one of the most important steps towards improving pain and fever control is better understanding of the nature of pain and fever in its treatment.
Evaluation. After 1 week, Hiran and his parents returned to the clinic for a reassessment, while his grandparents stayed home with his 3-year-old sister. Hiran is sitting on his mother's lap contently. Hiran's mother states that he has been afebrile for the past 6 days and is no longer irritable and crying. His current temperature is 37.2 degrees Celsius, his heart rate is 100 beats per minute, and his right tympanic membrane is pearly gray, shiny, and translucent with a visible light reflex. Hiran is not showing any signs or symptoms of infection or complications related to acute otitis media. However, his parents verbalized that they will continue the treatment for the remaining 3 days to prevent reoccurrence.